Live from Tampa Bay streaming news leader, this is ABC Action News, taking action for you.
Welcome everyone here to ABC Action News at 6. I'm Paul LaGrone.
And I'm Wendy Ryan. Thank you for joining us. All this week, we're investigating why so many of your medical claims get denied. It's part of our new series called Patient No More.
Tonight, we are introducing you to this group of women from all ages, all diagnosed with breast cancer, and all denied coverage for treatments their doctors recommended.
All of us have been denied life-saving measures. So just make it make sense.
Make it make sense. Well, tonight, I-Team investigative reporter Katie LaGrone is here listening to these 5 women and hearing their emotional experience with insurance denials.
She's also getting answers on why breast cancer patients are being denied coverage when there are laws in place that are supposed to protect them.
I feel like a ticking time bomb, and every day without getting the treatment that I need, I feel like there's just cancer everywhere. My name is Rachel Roth McKnight. I was diagnosed at the end of July with invasive ductal carcinoma.
This,
my name's Ashley Fox,
is a small gathering.
Diagnosed with invasive ductal carcinoma in June.
No one wants to be a part of.
Stage 2 breast cancer in my left breast, DCIS, when I was 30 years old. It makes me so mad. You can't appreciate what it feels like to be in this situation until you are, right?
That situation.
Go ahead and show us. I was denied my reconstruction.
I was denied the type of mesh that my doctor recommended.
Denied the mesh, radiation, PET scans, and an MRI. My doctor, just wants to make sure that because it is so aggressive that it hasn't spread, and we haven't really been able to look into every avenue yet.
Because the insurance company won't pay for it.
Right.
It's a problem doctors say that's becoming increasingly common. Patients diagnosed with breast cancer, then denied coverage by their insurance companies for treatments and screenings recommended by their physicians.
All of us have been denied life-saving measures. So just make it make sense.
Brittany MacArthur's insurance company refused to cover the cost of a mammogram, even though she had a large lump in her breast and a referral from her doctor. But at 30 years old, Brittany says her insurance company at the time told her she was too young for the life-saving test.
You have to laugh about it because it's crazy.
While it's unclear how often insurance companies cover the costs of cancer treatments, it's also unclear how often they get denied. Last year, 17% of Americans reported insurance denials for care recommended by their doctors, according to a study by the Commonwealth Fund, a nonprofit dedicated to promoting healthcare equity. And too often, doctors say, those denials lead to delays in care.
There's always, it's like this constant continuing loophole that you fall into.
It took nearly 6 months for Nancy Hudson to get her double mastectomy with reconstruction after she was diagnosed, because the mesh her doctor uses, though popular among surgeons, is considered experimental and reason for her insurance carrier to deny coverage. Denise Carrion waited more than a year.
The most frustrating part for me is the fact that this is against the law. This is against federal law. Where does that fit in here?
That federal law, known as the Women's Health and Cancer Rights Act, is supposed to protect patients who choose breast reconstruction after mastectomy. But nearly 30 years after it was passed, advancements in surgeries and treatments have paved the way for insurance company loopholes and denials, leaving Ashley Fox to pay half of her double mastectomy out of pocket.
They were only going to cover the cancerous breast. They would not cover the non-cancerous breast mastectomy.
There's no police. There's no system of enforcing.
Dr. Alicia Billington is a plastic and reconstructive surgeon in St. Pete.
I think it's money. I think it's greed. The crazy thing about that is actually, if you don't take care of patients appropriately, it ends up costing us more money because they're going to have to go back and get additional tests. They're going to end up getting more advanced cancer because they haven't had the right procedure done.
Billington now fighting to update state and federal laws to give breast cancer patients more protection.
An angel.
She is.
Ooh. Go ahead. You can come in here and do the hugs. Yeah. Thank you.
Thank you guys so much.
everything. I'm so proud of all of you guys.
Most of these women are her patients. She battled insurance to provide coverage for.
How many of you spent weeks fighting for coverage? How many of you spent months fighting for coverage? Years? How many are still fighting?
Past the years.
And how many of you ultimately had to pay something out of pocket? How much?
About 10.
10.
3 so far. I have this fear going forward that I may have to have some other surgeries. We're just at their mercy, and they can deny anything they want.
When all these women want is to beat their disease without getting beat down by insurance.
Powerful story. Katie joins us in the studio. How are state lawmakers responding to this? Are they in a position to do anything about it?
They are. Not this session. In fact, we just learned this morning, Representative Karen Gonzalez-Pittman, who actually represents parts of Hillsborough County, is working on a bill that would essentially modernize that act. It's the Women's Health and Cancer Rights Act, and essentially it just because it's 30 years old, it just doesn't cover everything. And so they are working to modernize it. I also know that at the federal level, there's also interest in tightening up this federal law. Dr. Alicia Billington, who really has been championing this for these patients and so many others for such a long time, is actually going to DC this summer to speak with Congress. I can tell you it is such a priority for so many who are advocating for this. Dr. Billington tells me, and along the patients who we spoke with, says there are at times the battle with their insurance industry is more intense than their battle with cancer.
Which says everything, right? To show the kind of stress that has. Yeah. And so many folks have already, monetary issues. And then to bring your health into it as well is just heartbreaking.
Right. For coverage, again, that should be provided.
Yes, that has been the law before the loopholes became known.
Which someone's got to enforce that law.
Right.
Yeah.
She said in the piece.
Exactly.
Yeah.
No policing.
Right. All right. Thank you, Katie. We appreciate it. Meanwhile, Katie's reporting on these women battling breast cancer and the insurance industry is part of a larger series our I-Team is working on called Patient No More. It's an in-depth look at why and how medical insurance companies deny coverage. It's something we're really proud of, and you may have seen our other reports just this week. Our Adam Walser took a unique look at the games insurance companies play, and our Susan El-Khoury helped get a woman's medical bill paid for worth over $370,000. If you missed those stories, please go to our website, abcactionnews.com/I-Team.